There's different ways to treat endometriosis, and so much of the treatment depends on what the symptoms are that bring you to the gynecologist. If your symptom is painful periods, then there are medications that you can take that will suppress ovulation and suppress the menstrual cycle, and these medications have been shown to be just as effective in treating the pain of endometriosis as having a surgical treatment. Now, having said that, typically you need a surgical procedure to make the diagnosis, and that is typically laparoscopy, which is an outpatient procedure involving the placement of a telescope through the belly button to evaluate the pelvis. Typically, when the diagnosis is made by laparoscopy, surgical intervention is performed at the same time using laser or using cautery to actually destroy the endometriotic implants. Unfortunately, we don't treat whatever it is about that particular woman that caused her to develop endometriosis in the first place. So this is clearly a condition that tends to recur over time. The best treatment there is pregnancy. And so many times we'll see women who have struggled with infertility and had a difficult time getting pregnant related to endometriosis. They get pregnant eventually, have a term delivery, and it's never a problem again. And the next conception may be easy. Most of the studies that have looked at the recurrence risk of endometriosis that's been treated with surgery show that the benefits last from a fertility perspective for an average of 9 months. Women who have pain as their primary symptom of endometriosis will be able to tell you when their endometriosis is recurring because their cycles start to become more and more painful over time. Endometriosis is a progressive disease, so if it's left untreated, it can spread and become worse. This is never a situation that is life-threatening, but it can cause pain, ovarian masses, and those types of problems. The good news is, once a woman approaches menopause and stops having periods regularly, the endometriosis almost always treats itself.